The purpose of the Healthcare Forum is to facilitate a dialogue among healthcare leaders focused on EMR adoption. We've assembled some of the most influential healthcare leaders today in order to address the new leadership agenda that's necessary for improved outcomes and sustained EMR adoption. We're lucky enough to have some of those folks sharing their perspectives on the critical issues.
IT's role in an EMR implementation should be that of logistical coordinator. Often, IT is looked at as being the owner of these types of projects, and we're really not. That happens because the organization generally imposes that ownership on IT and assumes because this has something to do with a computer, it must belong to IT. And none of these projects really belong to the IT department. They belong to the people who are going to use the products. At our institution for a number of years, the question was asked of me, when are you going to do CPOE? And my response was, never. I'm not a physician. When are the physicians going to do CPOE? When they're ready. So it's the same with in an EMR. It's very important that it not be owned by IT, and you need to be sure that you've constructed it so that it is owned by the practices, by the physicians, nurses, other people in the practices that are going to use the product on a day-to-day basis because they have to drive their process change. It's not about installing a computer and turning on a piece of software and then voila, you're done. It's about really engaging them to see how does this new tool impact the way they do their daily business. How does it impact everything from the check-in process when the patient arrives, to the follow-up process, to engagement with the patient in the room, to the patient's calling back for a refill. There's this, every process gets touched with the use of an EMR. If you just plan to put in the EMR and keep doing things the way you're doing, then you might as well save your money. We've been building our inpatient EMR for a number of years, and about 4 years ago, nursing decided it was time to enter vital signs and I&O data directly into the chart and no longer enter them on the paper. There were no physicians involved in that decision, and there were no physicians involved in the design of how that was going to look. It was perceived as being nursing, so nursing got to make all the decisions. And when we first rolled it out, we got huge pushback from the physicians to the extent that nursing had to put little whiteboards into the rooms and post the latest vitals and results on the whiteboard because they had not taken into account how the physician is going to have access to that data. So it was very interesting. It helped us understand that even those things that we don't think the physicians need to be involved in, they probably do. We have changed our approach to projects now that are governed. I have an IT governance group that is 50% physicians, and we assume that every project has to have a physician champion unless the IT governance group says otherwise. So we don't go in and saying, gee, do you think we need a physician champion for this one? It is, okay, who's going to be the physician champion for this project? And if the group says, well, that's an upgrade to the finance system and we're really not interested, then that can be okay. There were some changes made to our patient practice management system for our physician practices, and again, the physicians weren't involved, and we really heard about that one. We thought this is the front-end process, this is registration, this is scheduling, this affects billing. We had all those people involved, we had medical records involved, didn't involve the physicians, and they were impacted because their staff were impacted. So the complaints we got back from the physicians were, how come we weren't involved in this? Because now we're having delays getting the patients back to the rooms for us to see because they're being tied up in the front because the front staff are trying to deal with this new system you put in. So physicians need to be involved in a lot more than even what we think they should be involved in.
I believe in order for leadership to change for a successful EMR adoption, there are a number of things that need to adjust within the organization. The first is the commitment to the organization that EMR adoption is at least in your top 3 priorities for the organization. You want to create witness and followership for this effort. It's not a project. It's a way of being. It's a journey, a multi-year journey, and you need that commitment. And the commitment has to be not only internally with your constituencies, but certainly externally with your community boards, with your communities, and your patients and those that you serve each and every day. Another key element of a successful change for leadership is constant communication and visibility of leadership, communicating this effort as a key to advancing your mission as what you stand for and your purpose in serving your communities. Another competency that needs adjustment is around patience. Part of what leaders have to recognize is now I'm having to delegate more, I'm having to trust more. And rooted in trust are 3 elements: sincerity, competence, and reliability. And part of a leader, because much more of the capacity is extended to their direct reports, and trusting in that delegation effort in order to get many of the activities accomplished. And a final competence that's critically important is visibility in the leadership. And that means managing by walking around, being available, communicating, even when we don't know the answers, but being authentic, where my head, my heart, and my feet are aligned to this mission, to this work. And so that there is commitment from all of our associates, confident in management, confident in the direction, and they can speak to that with regards to this tremendous effort and what it will do to eventually help us serve our patients, our communities, our physicians, and all of those around us. In my experience doing EMR adoption at Trinity Health, one of our greatest learnings was the importance of culture. Culture must be aligned to your strategy and structure as part of an effective EMR adoption. And part of our learnings initially was we didn't spend enough time in that space. We were very quick to focus on the levers of technology, of processes, and we didn't spend time on our people and culture. We changed that. And so now part of our Get Ready process, 18 months out, begins with putting together a people plan. And to really ensure that we have the right leaders in place, that we're supporting them with the right training and preparation, that we're communicating their jobs and their roles, that we're explaining the decision matrix and how they'll be held accountable, and more importantly, how they'll be rewarded and recognized. I mean, the holy grail of human resources is for individuals to feel valued, that their voice is heard, and that they're at the table. And that has just been a significant ingredient as part of our success and our learning as at Trinity Health, over 75% of our organization is moving to electronic medical records. So we are still learning. We still are very much a learning organization, sharing best practices, and that's what it's all about as part of this journey, which is so exciting. So let me just share a story with you with regards to the success of one of our ministry organizations as it relates to EMR adoption. One of our ministry organizations in Oakland, Pontiac, had physicians that really were not supportive of our effort. We had a CEO at that ministry organization who was very committed, who persevered the skeptics and the sarcasms and the considerations of not doing this work. And so he went out and put together a special event just for the physicians. Even invited their wives or their significant others or family members to join this effort and to really connect the work around people and culture to the efforts of this technology advancement, really meeting them where they are and really talking about what was possible and really creating a new care experience by having this technology and this foundation in place to help make their job easier, to enjoy what they do so that they can live their passion, live out their destiny of giving great care. And at that meeting, I would say that over half of the physicians that were in attendance were not supportive. By the end of the evening and the next day, he had over 90% of those physicians engaged, committed to a 3-day retreat in the coming months to really participate, to engage with the hospital, and to pledge their commitment to doing everything that was possible to be successful. So when we talk about success of EMR adoption, let me just again echo and underscore the importance of the CEO and the leader at the top. The shadow that leader casts for the organization is powerful. The alignment of the organization to the strategy, the structure, and the culture with the people is critical. And this was just one example of how he created witness for this work, the followership, because people trusted in his leadership to not only do the smart thing, but to do the right thing to really advance our mission and to be able to serve our physicians in a way that was going to enable them to deliver a great care experience.
When a CEO or leader comes into the organization and says, we are going to implement an electronic medical record system and it's going to be done within 12 months, then it's just another project. When the CEO engages the leadership and the staff in trying to devise solutions to a problem related to either efficiency, improving clinical outcomes, acquiring quality data, it allows the staff to help ascertain what the appropriate tools are to get those goals achieved, then the EMR or EHR implementation project is the solution to a problem that's trying to be solved, as opposed to one more project or creating multiple problems that ultimately need to be solved. Achieving the meaningful use of electronic health information is not simply just another change. It's a transformation of how healthcare systems actually do business, and using technology as a tool or resource to get to some larger end goal or achieve a mission or value that the health system has put into place. And so if one goes into an EHR or EMR implementation as if it's a project or just another change, I think it's just doomed for failure. If the leadership helps establish buy-in and gets folks to understand that this is a transformation of how they do business within the institution, and the electronic health record system or the medical record system is simply a tool that enables them to do that, then the change that takes place will not just be a change that's seen as a project, but will be a change in how they do business every single day from that point forward. I've seen it done well and I've seen it done poorly. When I served as the interim commissioner of Georgia's Department of Community Health, I had the opportunity to oversee a huge, significant transformation using technology, which was a transformation of the fiscal agent system, which is the financial system that pays all the claims, not just for Medicaid, but we also transformed the claims payment for the employee benefits. The leadership that the governor gave there was paramount to the success of the project. Being involved, motivating the staff, motivating the team around what we wanted to achieve, which was improving efficiency and quality, is what led to the success of that project. Failure comes from lack of buy-in, lack of acceptance of why we're doing something, or even clear understanding around why we're doing something, and no understanding or value put in place around the consequences, the risk that come with the failure. And so I think the leadership that comes from the very, very top and trickles all the way down to the bottom is paramount to the success of the project.